everybody, this is Dr. Justin from Palmercare Chiropractic in Leesburg. Today I'm going to be demonstrating 3 different ways to adjust the lumbar spine. Now, my personal favorite way to do it is what's called a side posture adjustment. This is probably what you're used to when you're seeing any of the chiropractic videos of people adjusting the lower back on social media. But what we do is we lay our patient on the side. We obviously figure out which is the area that we're going to adjust. And now we did literally just adjust Adriana, so I'm going to show it as more of a demo today. So we go ahead and get the joints to open up, roll the patient over, and then put in a little bit of a force. That way we can get the joint to move correctly so we can take some pressure off of the disc space, take some pressure off of that nerve so the nerve can fire. All right, now let's come up and have a seat. Now, for some people that position is a little bit uncomfortable, or maybe they just are afraid they're gonna fall off the table, the other way that I like to do this is what's called an anterior lumbar. So I'll basically take this block, it's just gonna help the adjustment work a little bit smoother. I'm gonna have you give yourself a big hug. Go ahead and tuck the chin, slouch forward just a little bit, very, very good. And then what it is, we would just basically find the joint that's not moving and then have her fold over that spot. And all we're trying to do is introduce some type of extension into the system so that the joint is now moving correctly. And then of course, the last way that I will affect the lumbar spine is probably gonna be a recurring theme with some of these videos, quantum neurology. Let's have you lay on your back. Now what this technique does is it's literally designed to just bring neurological recognition to an area that needs to get fixed. That way the body can start to heal itself. So we're going to do a few tests. I'm going to test a few different nerves in your lumbar spine. We're just going to see if we can find something. I'm going to have you bend your legs straight down. Good. Kick straight up. All right. I'm going to push down. Don't let me. Good. I'm going to pull out. Don't let me. All right. So we found L3. So what I'm going to have you do, I'm just going to turn this light on. Point to your belly button, please. All right. Push down on your heel, take a deep breath in, exhale all the way up, push down on the heel. There we go. And exhale. Perfect. And relax. I'm gonna pull out, don't let me. Good. Now that muscle is rock solid, we basically turn back on the L3 nerve. And that is 3 ways to adjust the lumbar spine.